Talk 1150.
Good morning. I'm Dr. Jessica Saepoff. You're listening to Dental MD Radio on KKNW 1150 AM. I'm Dr. Jessica Saepoff. I am a holistic dentist, and I'm a general dentist. There's no specialty of holistic or biological or alternative dentistry or complementary dentistry or any of the other words that are sometimes used to describe the natural medicine approach to dentistry. And sometimes I think maybe there should be, because the general population of dentists is still doing things quite differently than the holistic and natural. However, it is general dentistry. And in reality, what we do and the way that we do it, in our opinion, should become how dentistry is done in the mainstream. So, in my opinion, it should be the least invasive and least toxic ways to do procedures possible. Less drilling, more healing and remineralization and prevention. That just, but I hear ads now on the radio and see articles that give sort of a lip service to these ideas, to these concepts. And they would even make you think, when they do their ad for their office, that they're doing less drilling by doing a crown. That is not less drilling. That's actually a lot of drilling when crowns are done. So you have to be discerning. You listen for the catchwords like less drilling, and we're trying to do less procedures, and we're trying to save your tooth structure. And then you get in there and they're like, we're going to save your teeth by doing all these procedures. Here's the list of what all your teeth need in order to save them. But it's kind of just a ploy to get people in. Just watch out for these gimmicks and these kind of lookalikes. They sound like they'll talk a little bit about nutrition, they'll talk about remineralization, and then they want to get in there with their fluoride and their procedures to fix, because their entire business model is designed around procedures. And if they don't find procedures to do in your mouth, then they can't stay in business. So they've got to find procedures to do. That is, that's just the way it is for a lot of dental offices. And, How does an office like mine stay in business by doing as few procedures as possible? The reason is because I do not use my dental exam, as a loss leader. Some dentists will discount their exam and cleaning, but if they don't find something to do in your mouth, they don't find some procedures to do, they're going to lose money on that because they've given a discount. So they've got to find something to do in your mouth or they lose money. That's not the way I have mine set up. I have mine set up so that when you come in for an exam and cleaning, yes, it does cost a little bit more for the exam and cleaning, but I'm actually hoping I don't find anything to do. And when I don't find anything to do because your mouth is healthy, I'm not losing money. So I'm not trying to talk you into elective care or, doing things to improve how your smile looks and preying on your possible insecurities about your beauty, physical beauty of your mouth and your smile. That's what dentists are led into doing because they need to do procedures. And if it turns out that they can't justify any procedures in your mouth because of clinical need, then they will turn to trying to twist your arm into elective care that's, braces and fix your smile and veneers and, bleaching and whatever. Because if they don't do something, they've lost money. So my business model is charge appropriately for my time when I do an exam And I really have no vested interest in you having something wrong with your mouth. So that is why I do not have to find procedures to do. I'm very happy if I don't find anything to do in your mouth or your kids' mouths. So that is a little introduction on what to look for and what to listen for when you are hearing ads for dentistry, for dental offices, or you go into a dental office and they seem like maybe they're on the same page, but then you're in the chair having a procedure done and it suddenly dawns on you that this is not more conservative. This is a lot of procedures and a lot of getting talked into stuff. And actually, they tend to use fear of whatever they think you might be worried about to help convince you to sign the treatment plan and make an appointment to come in. And they usually make it sound like it's urgent. They try to make it sound like whatever it is you need to get done, you need to get it done as soon as possible. And they've got a lot of reasons and justifications and ways to make you feel like if you try to take your time making a decision about that tooth, this list of terrible things could happen to that bone, the gum, the tooth, the nerve, all that stuff. And they really like to emphasize that all the way up until you actually get to the front desk and make that appointment, and then they stop. So anyway, be on the lookout. Don't cave to any high-pressure sales tactics. Dentists are all trained in high-pressure sales. It's really awful, but it's true. And they actually go to courses to learn how to sell treatment plans, how to close the deal. And it's all the same stuff as everybody else that's out there trying to sell you stuff. Those techniques applied to healthcare, yes, where you are made to feel like you've got to, jump in and do something quick or else, doom and gloom. So watch out for the high-pressure sales along with the reassuring smiles in most dental offices. And dentists have to be pretty invasive to make a living these days in many offices. And I really feel for them. I'm sorry that their business model is set up like that. It's pretty stressful for them to have to be under that kind of pressure and be completely dependent like that on people having breakdowns in their health in order for them to make a living. I would like to earn my money by helping people stay healthy and be healthy rather than looking for stuff that's gone wrong or hoping things will go wrong. So it's in some they don't really hope things go wrong. I don't mean to imply that. I just mean that they're really happy when they find stuff to do, things, anyway. It's that business model leads dentists and dental offices to actually seek the breakdowns in your mouth and broken things and things that need work, because that's how they make their money. All right, I think beating a dead horse at this point. All right, so I just wanted to go a little bit into some of the differences, what to listen for. Don't be fooled. Especially in this area in Western Washington, there are a lot of holistic practitioners. There's a lot of the public is very educated about nutrition in general, more than a lot of other areas of the country. And so the mainstream practitioners, they know about this and they kind of figure out what to say to try to get those health conscious people in and mainstream them into their office and have them agree to have stuff done. So they kind of have learned what to say to the health conscious community to do their sales pitch. And they will say things that sound good and that sound holistic and sound conservative. So just be on the lookout for that. It's kind of tricky. Got to be discerning. All right. So there are no holistic dental schools. There are no natural dental schools. There's natural medicine. There are physicians training programs like at Bastyr. You can become a naturopathic physician and be kind of a natural equivalent to an MD, although they tend not to have surgical training and emergency care training, that kind of thing. So they're more preventive and build your health up and build your systemic immunity and all that stuff. But they are physicians, and there is training for naturopathic physicians, but there's no naturopathic dentistry schools. So any of the dentists who are natural or practice in a naturopathic style or manner, we've all come to that way of practicing outside of mainstream channels of education. So we've had to join other kinds of organizations and read a lot of stuff, and kind of it's on-the-job training. It's a lot of times dentists get there because someone in their family has given up on mainstream or veered away from mainstream care in order to get more natural care, and so because of that, they've learned about this parallel universe of natural and holistic techniques and concepts. Or they themselves have had health crisis that has their journey has led them to more natural care. There are a lot of different ways that dentists get there. In my particular case, just briefly, I will say I became natural and holistic way back in the 70s when my parents overhauled the kitchen, and all of a sudden all the Wonder Bread was gone and everything refined was gone, margarine was gone, and all of a sudden there was whole grain, everything, and whole food, unrefined, real food, no more processed foods. Everything got completely turned upside down, and I've been involved with nutrition and holistic living ever since then. And then I also have an art degree, which I used that time in my life to learn to look at things from other people's points of view in order to learn, in order to understand other ways of looking at things, other possible solutions to things by trying on other concepts and other ideas to see what fits and what doesn't, and using what works and throwing out what doesn't. And I've developed a fairly, my operating model, which I go by until or unless, nothing is hard rock, cut in stone. Everything is a working model for me, and I operate as though certain things are true until or unless I get more information or more evidence that changes my mind, and then I will adjust my working model. So that's the way I go through life. And so when patients asked me about mercury and fluoride after I was done with dental school, I said, well, those are interesting questions. I know what the American Dental Association has to say about those things, but why are you asking that? What are you reading that's leading you to question this and wonder about it? And they gave me what they were reading, and I read it, and that began my journey. Because, like I said, I'm open to looking at why other people might have a different point of view and where that view comes from, and seeing what might be legitimate there and valid. So that is how I started my journey of looking at things from this other point of view. So you're listening to Dental MD. I am Dr. Jessica Saepoff. In the next segment, I'm going to begin talking about TMJ therapy and the anatomy of the jaw joint so that people can understand what is happening in their jaw joint and what the options are for doing something about that if they should choose to do so. All right, I'm going to take a break. I'll be right back.
A promise was made. A promise that hit the beaches of Normandy. A covenant that split the skies over Berlin. A vow that captured Iwo Jima. A promise was made. A solemn oath that liberated Seoul. A sacred trust that defended Quezon. A pact that dug in Da Nang. A contract that weathered Tet. A promise was made. A pledge that stormed the desert in Iraq. A bond that patrolled door to door in Fallujah. An IOU that braved IEDs in Kandahar. A promise was made to America's veterans a promise we all must keep. DAV fights for all veterans and their families so they get the health care, financial benefits, and support they earned. If you're a veteran who needs help or you'd like to help us keep the promise, visit DAV.org.
So how long has it been since you've been to the dentist? Yeah, I'm talking to you. I know going to the dentist can be tough, but did you know that healthy teeth lead to a healthy body? I know what you're thinking. All dentists are alike. They lure you in for the free exam or, complimentary cleaning. And before you know it, wham! Huge dental bill. And did you even need all that work? Well, why not try a different approach? Natural Dental Health Associates in Issaquah specializes in taking care of you. Their easy, no gimmick, honest approach to dentistry will have you forgetting you're actually in a dentist's office. And the best thing is, they're all natural. Yep, no mercury, nickel, or other harmful chemicals are used. Click on your media player now and get started on the road to better dental health today. Or call 425-427-8899. Natural Dental Health Associates is a proud sponsor of the Dental MD radio show, Wednesdays at 9 a.m. on Alternative Talk, 1150 a.m.
Spread the word. Your favorite shows are on Alternative Talk, 1150 a.m.
1, 2, get down.
Welcome back. You're listening to Dental MD. I'm Dr. Jessica Saepoff. And today, in the first segment, I talked about kind of an introduction to discernment on whether a dental office is actually holistic and natural or whether they're just saying the things that they know you want to hear and then getting in there and doing a lot of drilling. So just be aware. And so in this next segment now, I'm going to start talking about today's topic, which is TMJ, and I'm going to cover the anatomy. TMJ stands for temporomandibular joint. That's your jaw joint. And if you open and close your mouth, that is the joint that is rotating as you open and close. And then when you bite your teeth together, there's a whole bunch of cushioning in the joint between your ear and the joint itself and above the joint that act like pillows in there, cushions, so that when you bite, you don't damage the joint. All of your joints have some form of cushioning. There are different kinds of joints. Some are synovial joints and others are, they're just different kinds. So the TMJ and the knee are both synovial joints, which means they have kind of an enclosed capsule with synovial fluid inside there. All right, so the jaw joint, I'm going to also talk about the anatomy of what is happening as you open and close your mouth and what happens in the joint when things go wrong, because there's this little disc that's in the joint that can become quite noisy, and it can also get damaged, and it can get out of position and get squished and damaged and have problems. And at one end of that little disc is a ligament, and ligaments, when they get stretched and pulled, and they can hurt, and they're like an elastic band. If they get stretched too far for too long, they will never go back to their original size and shape, just like when you sprain any joint. First of all, it can take up to 6 weeks for that joint to feel better if you've stretched a ligament and sprained something in there, just like an ankle. And forever in your ankle, if it's an ankle, forever you have to be careful because that side of your foot is a little weaker because things got stretched. And, it heals, but it doesn't ever go back to exactly how it was. So in some cases, they will even say, such as in my case when I broke my ankle years ago, when I sprained my ankle, they told me that I would have been better off breaking my ankle than the kind of sprain I had because I would always have trouble, which I don't have any trouble with my ankles. But that's what they told me at the hospital. So you do want to be careful about stretching ligaments and stretching exercises for your jaw joint. If the ligament is being pulled and the disc that's attached to that is caught or stuck in the wrong position, opening and stretching open past where your jaw would naturally stop because that ligament stops you. Just trying to stretch open to have a better range of motion is a bad idea in that case because you're just stretching and stretching a ligament that shouldn't be getting stretched like that. And it's being stretched because the disc is caught in the wrong position. Literally, your joint is dislocated. The disc is out of position and can't get back in some cases. That's a non-reducing dislocation. And then a reducing dislocation, you'll know it's reducing because it will click or pop. And that's the disc popping back into the right place or popping out of the right position into the wrong position. And you will feel and or hear a click or a pop depending on which direction it's going and how much of the disc is going out of the position. So in the late stages of this, the disc may have been out of position for such a long time that your bone of the jaw joint itself may be right up against the temporal bone. That's why it's the temporomandibular joint. The jaw, which is your mandible, has a part that goes up and sits inside of a fossa, which is a big curvature there right in front of your ear. And the fossa or indentation in the temporal bone is where your jaw joint sits. And in that, if the disc has been out of position and the space is reduced, you may have bone on bone, or you may have nearly bone on bone, which will result in a condition we call crepitus, and you will know because it will feel and sound crunchy and grindy. So, and that may not hurt. I know that sounds bad, but it doesn't always hurt. Pain in the joint is from inflammation. Some of these conditions have been so long-standing and chronic that there really isn't inflammation anymore, or the person is taking a lot of anti-inflammatories for their knees or hips already, and so their jaw doesn't hurt anymore. But just because there isn't pain in the joint doesn't mean everything's okay in there, or that it's okay to leave it like that. But in the mainstream view, if you're not having pain, then there's no reason to do anything about it unless you're so closed you can't open wide enough to be functional, like eating food and that kind of thing. Then they would do something about it. So, if your jaw joint is dislocated, which basically means the little disc cushion that's supposed to be between the mandible, the condyle of the mandible, and the fossa, inside the fossa there of your temporal bone. When that little cushion, which we call the disc, is out of position, that's a dislocation. That's a dislocated joint. Anywhere else in your body, a dislocation is something that, sometimes if it's due to trauma, it's really an emergency procedure to fix that. Other times it's just a hypermobile joint and it can dislocate and pop back into place, and that becomes sort of a chronic thing that your shoulder or elbow or whatever can do, or fingers. And that's just kind of, they just usually just tell you to be careful and not overextend it like that. But in most cases, a dislocated joint is something that requires treatment unless it's in your jaw, and then it's ignored, or other things are done like, let's work on all these trigger points and see if we can get rid of all the referred pain around your jaw joint. And now, yay, you don't have to get your jaw fixed. But no, not necessarily. That's all fine, but it's just another pain relief method. And that's good. Get out of pain for sure. And maybe get rid of all the referral pain patterns so that you can find out which pain is actually emanating from the joint and the derangement inside the joint itself versus pain around your ear and your jaw that's coming from a neck muscle. Yes, rule those things out. But a lot of practitioners will work on these other muscles and the referral patterns in order to solve, they think they're solving the problem, and they're leaving you with a dislocated joint, but they're saying, well, we've gotten rid of the pain in your joint. See, you didn't need TMJ therapy. Isn't that great? But, it is good that they've gotten rid of the pain and that they've, isolated where some of that pain was coming from. But that does not necessarily mean it's okay to leave your jaw dislocated and your range of motion impaired in your jaw joint, because your disc may be trapped in the wrong position, or it may still be able to click back and forth into the right position and then out again as you open and close. And that is something that's, in a lot of cases, that's very simple to fix. And it's also pretty simple to prevent if you know how to prevent it in kids. The jaw joint just needs to be aligned during orthodontic treatment rather than ignored during orthodontic treatment, which if it's ignored, then the teeth get lined up so they look nice and the jaw stays out of alignment. And if it's taken into consideration, then the jaw is aligned first and then the teeth are moved to support that, proper alignment in the jaw joint, which is a great idea because according to a lot of research and a lot of practitioners, that prevents problems down the road for that person in terms of TMJ problems, jaw joint problems. There is a line of research out there right now, a mainstream view that is trying to become the predominant view about this issue. And what they're saying is that everything I just said is wrong, and that in reality, the only reason there are any joint problems is because of trauma and injury, and that these problems later in life cannot be prevented in any way, shape, or form. That no matter what we do to align the joint, if there was a trauma, there will be pain and clicking and degeneration in the joint, and nothing we do to align it or create space in there or create a disc that doesn't continuously dislocate, which is that popping and clicking, that those alignment strategies do not prevent problems later. And I don't agree with that. I think they do prevent problems, but there's this big body of research now out there trying to create a mainstream predominant view that there is no way to prevent these things. And if you have trauma, then you're going to have these degenerative problems later. And that may be true, but it still may be possible to prevent some of the degenerative problems by proper alignment early on in life. Okay, you're listening to Dental MD. I'm Dr. Jessica Saepoff, and I'm talking about TMJ and covering the anatomy so you really understand what's happening. And we're going to talk about treatment strategies in the next segment. I'll be right back.
I'm Dr. Anthony Lazowitz, and this is Climate Connections. Fossil fuels may soon need to compete with a much greener source of energy, biodiesel made from algae. You might think of algae only as green slime, but there are thousands of species, including some that grow so fast they double in mass within hours, an attractive feature for biofuel production. And through photosynthesis, algae remove climate-warming carbon dioxide from the air as they grow. While algal biofuel is not yet cost competitive, the Department of Energy hopes to get the price below $5 a gallon within the next 4 years. Meenakshi Bhattacharjee of the Center for Applied Algal Research at Rice University believes that's doable.
Algae can have a lot of good uses, and that can be exploited to make the whole algal biodiesel production very economical.
For example, after the algae is used to produce biodiesel, the leftover biomass can be used as fertilizer. Algae can also be grown in and help clean wastewater. They purify the water as they use the dissolved nutrients to grow. Algae can even be used to absorb the carbon dioxide emitted from factories, keeping it out of the atmosphere. So by optimizing algae's many benefits, Bhattacharjee believes scientists can make algal biofuel cost competitive and widely used within 10 years. Climate Connections is produced by the Yale Center for Environmental Communication. Learn more at yaleclimateconnections.org.
Alternative Talk 1150. We're on your radio at 1150 a.m. We're on your HD radio at 98.9 Channel 3.
So many ways to listen.
We're on the web at 1150kknw.com, streaming live audio and video as well as MP3 archives of many of our shows.
So many ways to listen.
And now, we're on your smartphone or tablet. Download our free app in the Apple App Store or Google Play and take Alternative Talk 1150 anywhere you go.
So many ways to listen.
Stay informed with news, traffic, and weather at the top of the hour, weekdays on Alternative Talk, 1150 a.m.
Welcome back. You're listening to Dental MD. I'm Dr. Jessica Saepoff. Today I'm talking about TMJ and the anatomy that goes with it, so you really understand what's happening in your jaw joint when it's popping, clicking, grinding, when you bite your teeth together, what is supposed to be happening inside the joint. So, one of the strategies for aligning the joint, there are a lot of different ways to do this, and there are actually companies out there that sell very expensive equipment to dentists to do all this analysis of the jaw joint and all this stuff. And yeah, some records are necessary and some, x-rays to really, confirm the diagnosis and verify that there isn't anything else happening there that, would change the treatment plan. That's all fine, well and good. There are ways to use special kinds of stethoscope type things to listen to the joint, which may or may not help in the diagnosis. It certainly helps build the case that there's something happening in the jaw joint that shouldn't be happening, or confirm health in the jaw joint if the sounds are normal. There are jaw tracking devices that measure how far your jaw can move and what the muscles are doing while you're moving your jaw. And there are devices for hooking up electrodes to all the muscles that are working as you open and close your jaw and measuring what each muscle is doing and at what amplitude and all of this stuff and which muscles are firing when. And if it's this muscle, then we better do this. And if it's that muscle, then, that's firing too much and we need to do that. And all this very complex, and this equipment is $20,000 or $30,000, and frankly, if a dentist is spending that kind of money to measure your muscle activity, it doesn't. I've looked at all that equipment, and I even tried some out, and it didn't change what I did for people or even how I did it, and I got the same results. So, but for a dentist that spends, tens of thousands of dollars on equipment to diagnose stuff, they are not hoping that everybody's jaw is healthy. Because if everybody's jaw was healthy, yes, they can still charge for all the diagnostic workup and all of that, but they're looking for a return on their investment. And, I talk about this, and in a lot of dentists' minds, this is subconscious. This is not deliberate. This is not, I guess in some cases it might be, but they're not deliberately hoping that you have a problem in your joint. They're not deliberately hoping that there's something that, that you need done, so that it's a subconscious thing. And when you do have something wrong that they can fix or know how to fix, and they can, bill your insurance and bill you for that treatment, that is what they're there to do. They're there to help you. They're there to do procedures to help fix things, to make money, because that's how they make their living. So, but again, I'm going to get back to the basic concept of how I have decided to practice dentistry. And even though I am here to fix things, and I know how to, and I know how to alleviate pain in a lot of cases, and that's all great, but really I've worked to make sure that I don't come from a point of view where I actually hope, and I don't want to come from the point of view of hoping that I find things wrong so that I can fix them and make money. And there are even some dentists that want their patients, and I know this for a fact because I have heard some of them say it, that they actually want patients to become dependent on them for ongoing adjustments and treatment for TMJ, because that way they can continue to charge that patient every month for adjustments and this and that. there needs to be an end point to treatment. It kind of reminds me of some chiropractors, not all of them, but some that want to get you into a long-term plan of continuing adjustments pretty much forever, because there's a philosophy that the spine and the joints and everything else will just continually go out of alignment, and you need to be continually realigned. And anyway, that's one model of looking at things, and it isn't necessarily the only way. So I want to continue to come from the point of view of hoping that I don't find anything wrong with you, that in my exam and evaluation that I find everything to be functioning correctly, and that there isn't anything wrong that needs work, and that maybe just some coaching on exercise and nutrition and things like that are all that is necessary. In a lot of cases, there is already joint degeneration and problems and clicking, popping, and or pain. And pain is not the only reason to treat, as I was saying earlier. So I was talking about all this diagnostic equipment, which may not be needed, and I didn't find it to be necessary. I do think imaging with x-rays is necessary to rule out other things so that we know, that the treatment that we're going to do, that there isn't anything else we need to take into consideration before starting treatment, like a tumor, for instance, or something like that. You do want to rule out other stuff before you start treating something, and that makes sense. But there's a lot of overdoing it on that. There's a lot of over-engineering in dentistry in general. So as far as the aligning of the jaw joint, there are a lot of reasons why the joint might have problems. In some cases, it is trauma. In other, like a blow to the jaw or the head or the neck. And, when you have an accident that happens or some kind of injury, of course, the emergency room and the physicians are looking for concussions and bleeding and broken bones and all that kind of thing. And a lot of times the jaw joint injuries don't become apparent until later. So sometimes it's not even associated with the accident. And in other cases, the reason that there was an injury in the jaw joint is because things were already out of position. So if something is misaligned and then there's an injury that happens, there's going to be a lot more severity to that injury. If things are aligned correctly and there's an injury, your chances of having a more minor problem to fix are greater. So having things aligned, it does make injuries less severe overall. So aligning the jaw joint, I was talking about different ways to accomplish that. One of the ways is to simply move the upper and lower jaw into and the upper jaw doesn't move on its own. I'm talking about orthopedic and orthodontic, like expanders and reverse pull headgear that moves the mid-face and upper jaw forward and down where it belongs to get it into harmony with the structures of the neck and the rest of the head. If the upper jaw and the lower jaw are moved to positions that are considered a class 1 orthodontic position, that is, in that position, it is most likely that the jaw joint will be aligned and the disc will be in place. And sure enough, what I find is that when I move the lower jaw, which moves easily, because it's meant to move. It's designed to open and close and move forward and back and side to side. When we just allow the muscles that are attached all around and underneath and inside and outside the jaw joint, because those muscles are there for chewing and moving your jaw, for speaking and swallowing and everything else. When we move that jaw and allow the muscles to balance themselves at their correct lengths and in harmony with each other, and the speech and swallow are functioning without the head moving forward or the facial muscles scrunching up to seal the mouth, those kinds of aberrant muscle activities. When everything's functioning, the muscles are in harmony and functioning where they're supposed to for speaking and swallowing, then, and I want to say chewing, except sometimes the teeth are not in harmony with that jaw position, the jaw will generally, at that time when the muscles are balanced, the jaw joint will be naturally aligned because that's part of the harmony of the entire system. And sure enough, when we allow the muscles to balance and we give the patient something to bite on that supports that position, from there, opening and closing, if that jaw joint disc is in the right place or close to the right place, it will slip back into the right position, and opening and closing will be easier. The range of motion will improve, the pain will stop, and the clicking and noise will stop. And those are all signs that the jaw joint is now in alignment. Now, generally what happens is we take the little piece out that we've put between the teeth to support that position, and we let the patient go back to biting on their own teeth, and lo and behold, the click starts again. The muscles are out of harmony and may start firing off again and going into spasm or developing trigger point knots in the muscle fibers, and the head will come forward during swallowing. All of those muscle disharmonies will recur, and that clicking and popping will be there. And that's how we can tell the difference between an aligned joint and a misaligned joint. A joint that is out of alignment, has a derangement or a dislocated disc. And so there are a lot of just very simple things we can do to get that aligned, and then the noise and the range of motion, all those things are signs that things are aligned. And I don't normally re-x-ray people to verify it. We just, at that point, we go by symptoms and, how the head posture and swallow and speech and bite are in harmony. So that's a basic on how to tell if the joint is aligned or not. And then in the next segment, I'm going to talk about what we do about the teeth if that position of harmony is not one where your teeth come together. If you bring your teeth together and everything goes out of harmony, then something needs to be done about the bite, how the teeth are positioned for that bite, in order to allow the lower jaw and the joint to stay in alignment and the muscles to stay in their harmonious, balanced positions where they're comfortable and don't develop spasms and knots. All right. And pain, which, by the way, can refer into the ear, the joint, the neck, the head, headaches, face pain, all kinds of referred pain patterns come from the disharmonies and the muscle knots. Okay, you're listening to Dental MD. I'm Dr. Jessica Saepoff. In the next segment, I'm going to talk about how we deal with the teeth themselves in this situation, and I'll be right back.
So how long has it been since you've been to the dentist? Yeah, I'm talking to you. I know going to the dentist can be tough, but did you know that healthy teeth lead to a healthy body? I know what you're thinking. All dentists are alike. They lure you in for the free exam or, complimentary cleaning. And before you know it, wham! Huge dental bill. And did you even need all that work? Well, why not try a different approach? Natural Dental Health Associates in Issaquah specializes in taking care of you. Their easy, no gimmick, honest approach to dentistry will have you forgetting you're actually in a dentist's office. And the best thing is, they're all natural. Yep, no mercury, nickel, or other harmful chemicals are used. Click on your media player now and get started on the road to better dental health today. Or call 425-427-8899. Natural Dental Health Associates is a proud sponsor of the Dental MD radio show, Wednesdays at 9 a.m. on Alternative Talk, 1150 a.m.
With the cold, wet weather settling in and winter upon us, the thought of those experiencing homelessness, those sleeping outside at this time of year, is simply not acceptable. In East King County, there are over 850 men experiencing homelessness at any given time. Where do they go when the weather turns cold? There is somewhere to turn, where they can find a safe place to sleep, a warm meal, and the support to regain stability for their lives. Congregations for the Homeless, the full-service shelter program for men on the East Side, is there to help, providing the support and resources we all need to live. Shelter and nourishment, the most basic needs that most of us take for granted. If you are a man experiencing homelessness, or if you want to support the homeless over the winter months, please reach out at 206-579-6607 or online at cfhomeless.org. That's 206-579-6607 or cfhomeless.org. CFH, from homelessness to housing, one man at a time.
It's time that you are heard, and I don't mean in just a conversation. I mean really heard. Imagine hosting your very own radio program on Alternative Talk 1150. Talk about being heard. Call 425-653-1150 right now to learn how affordable it can be to host your own radio show. Time slots are going fast, so take hold of this chance by dialing 425-653-1150. Alternative Talk. We have an opportunity waiting just for you. News, traffic, and weather? Now you can get your information fix weekdays on Alternative Talk, 1150 a.m.
Get down.
And welcome back. You're listening to Dental MD. I'm Dr. Jessica Saepoff. And we're talking about TMJ therapy today and the anatomy that goes with it so that you can understand more about what is happening inside your jaw joint. So behind the condyle itself, which is the round top part of your jaw joint, of your mandible, and the mandible is the lower jaw, which has the lower teeth in it. And when you open and close, if you put your finger in front of your ear, the part that you can feel moving right in front of your ear is the round ball of the condyle, which is rotating and then sliding down a slope inside the jaw joint where it belongs. It's supposed to do that. And the disc is supposed to slide with it as you open your jaw. But if your disc is under pressure in there, it may slip out of position like a bar of soap and go in front of the condyle as you're trying to open, which will stop you from being able to open as wide as you're supposed to. You are supposed to be able to open wide enough easily without pain. You're supposed to be able to open wide enough to be able to get 3 fingers vertically at the same time. Just make like a peace sign, but put 3 fingers and put them together and turn them vertically so that they're one on top of another, and then just see if you can place 3 fingers at the same time between your upper teeth and your lower teeth in the front. If you can do that, then you're in the range of normal opening. If you can only put 2 fingers or 1 finger, then you are not able to open as wide as you're supposed to be able to. And it doesn't just mean you have a small mouth. It means something is happening in the joint that's stopping you from having a full range of motion. So as you're opening, that disc is supposed to be sliding down as you're opening and sliding and staying on top of the round ball at the top of your condyle, which is at the top of your mandible there, right in front of your ear. And behind that condyle is your ear canal, but between the condyle and your ear canal is a bunch of soft tissue called the trilaminar zone, and it's full of blood vessels and nerves and connective tissue. And when you bite together, if your jaw joint clicks a little bit as you're biting, kind of shifts back towards your ear, you're actually compressing that soft tissue behind your condyle, between your jaw joint and your ear. And that tissue is not meant to be compressed. And it can cause problems. It can decrease blood flow. It can cause compression back there. It can cause ear symptoms because of the compression of the ear canal and other parts of your ear. So it can even result in ringing in the ears in some cases. There are a lot of cases of ringing in the ears that are not related to the jaw, but a few of those cases are. Sometimes headaches are related to this. There are lots of headaches that aren't cured by working with the jaw joint, but that most of these things have a lot of possible causes. But when we can align the jaw joint and some of these problems get solved, that's a very good thing. So in this segment, I want to talk about what we do with the teeth. The teeth themselves, if the only way to keep the jaw joint aligned is to place something between the teeth, that means the teeth are not in their right positions. They're either worn down or they were ground down and crowns were made and they weren't, maybe the dental restorations were not done at the right position to support the jaw alignment and muscle balance, or orthodontic treatment was done and the result was beautiful straight teeth a long time ago, but perhaps the jaw joints weren't aligned well at the time that the teeth were straightened and moved, and so now you're kind of locked into a bite with the teeth that does not match alignment with the joint. And when the joint is aligned, all of a sudden the teeth no longer meet correctly. Sometimes people will go to massage therapists or chiropractors who will work with their jaw and get that aligned. And then the patient comes to me and says, my jaw feels better, but my teeth don't meet right. That's because chiropractors and massage therapists and physical therapists and anybody else working with the jaw joint, they better understand what the impact is going to be on the teeth and on the bite. But they're out there trying to fix the pain problem and align, maybe even trying to align things and kind of ignoring the other part where the little white things are that only dentists are allowed to treat. And they don't necessarily understand that they've caused a change in the way the white things meet, the way the teeth meet. And the only profession that's allowed to do anything with that part are dentists. So dentists should also be the ones working with the jaw joint. Now, we can work in conjunction with somebody who's working with the joint as long as they understand that what they're doing changes the bite and that needs to be addressed by a dentist who knows how to fix that. But just getting the person back biting on their own teeth again doesn't solve the problem, because that throws the jaw joint out of alignment again in order for the teeth to meet. And if they can do that and the pain doesn't return, they figure they've fixed it. But if you still have a misaligned joint and unhappy muscles, somewhere down the road there's going to be a problem with the structures in that joint. If they're under stress, even if it's not painful at the time, it can become painful later, or maybe even not painful, but just, degeneration due to pressures and forces inside the joint, and also the muscles, which the muscles can, of the chewing and biting and swallowing and all of those things, if those muscles go into spasm or develop trigger point myofascial pain, dysfunction, which is little muscle fibers that are knotted up and can cause referred pain. These things from your upper back and shoulders and neck muscles and jaw muscles can throw pain into a lot of different places. And, there's a whole science of studying where the referral patterns are. And sometimes, actually most of the time, the referral patterns result in pain somewhere distant from where that muscle problem is. And that pain area is what practitioners focus on. Oh, your head hurts. Let's focus on your head. And they don't necessarily understand that pain is coming from a distant muscle that just has a referral pattern that includes that part of the head. Anyway, that would be like treating someone's left arm, because they have arm pain, and never looking to see if they're having a heart attack. I mean, we all know now that a heart attack, the muscle of the heart, can refer pain into the left arm and into the jaw. And we've been taught, now everybody kind of knows that you look for these referral patterns. You don't just treat the arm pain and ignore the possibility of a heart attack. So this isn't quite that drop dead serious, but it is pain and it is referral patterns. And there's so much disinformation and misunderstanding among a lot of different practitioners. So a dentist that's knowledgeable about all this stuff is really your quarterback. That's really your central location where to go to get these things evaluated. But Dentists have to understand all these different areas and understand how to coordinate treatment between different practitioners and their own work, which is going to be more on the teeth and the joint alignment. Okay, well, we've reached the end of our hour. You've been listening to Dental MD. I'm Dr. Jessica Saepoff. If you have other questions about this topic or any other dental topic or natural dentistry and medicine in general, please give us a call at 425-427-8899 or reach the front desk by email, appointments@naturaldentist.com. Thank you for listening. I'll be back next week.